There's a medical condition commonly known as the greatest mimic of all time, and today I'd like us to put on our Sherlock Holmes hats and explore the world of SLE in full, systemic lupus erythematosus. So this is an autoimmune disease commonly affecting women of reproductive age, presenting with an array of symptoms which may lead to the diagnosis escaping the attention of the clinicians or the physicians dealing with the patient. So by autoimmune disease, I mean that the body is attacking itself. And how does this happen in a case where we have SLE? When there is damage to the cell can either be repaired such that it becomes healthy again, and if it is beyond repair, then it undergoes apoptosis, which is automated cell death. So in the situation where we have automatic cell death, that means, of course, the cell dies and the components of the cell are in a way released into the surrounding environment. And when that happens, the body has janitors that come do their due diligence to clean up the mess that has been left behind by the cells that have died. But if these janitors don't do a good job, traces of the things that are within the cell are left in the environment. So we have cells called antigen-presenting cells. These are the cells that normally patrol the body to look out for any harmful things in the system. So when they come along this place, often they're normally immature antigen-presenting cells. So they come and realize, there are things that we're noticing in this environment that are not supposed to be here. So do these antigen-presenting cells do? They carry this specimen they have found that the janitors did not clear and take it to the immunity headquarters, present it to the T cells and the B cells. Now the T cells and the B cells are the cells that are responsible for our body immunity. Now because these T cells and B cells have been presented with something that does not normally occur in the system, what they do is that they create a defense system against this thing that has been found randomly in the body. Remember, this thing is a part of a cell and the cell was a part of the body. And these things that have been released into the system often are found in other cells as well in the body. So in this way we can say that the body is forming defense against itself. And that's how autoimmunity comes about. Now, because we've established that when the body creates this defense system, it will attack its own cells, and whatever we are creating a defense against is found in many parts of the body, then there's going to be an array of symptoms that these patients will present with, and that is what makes this disease a great mimic. Because often their patients will just have skin conditions, others will just have joint problems, others will just have headaches, and sometimes having these scattered symptoms can, potentially escape the attention of the health worker attending to the patient. So these symptoms commonly are headaches. We have skin conditions, often on sun-exposed areas. So we have a butterfly rash called a malar rash around the cheeks. We have a discoid rash, it looks like a coin, often on the sun-exposed areas. We have sensitivity to the sun. We have low blood levels, so you often go to the hospital and you're told, hey, your blood is low, hey, your blood is low. Joint pains, kidney problems, seizures at times, and sometimes you can have ulcerations in the mouth and other times in the nose. So you see, it's a whole lot of symptoms that can present singly or in a combination. So this is what makes this disease a very great mimic. Having said it commonly affects women of reproductive age, there are stressors. Now that SLE becomes an autoimmune condition, there are times it is chill, other times it's all the way out there. And there are stressors that can bring about these flare-ups. These stressors can be psychological stress itself, diseases, some medication, and sometimes pregnancy. So when these flare-ups occur, they can present as a collection of symptoms, or just one symptom occurs continuously. So once you present with these kinds of symptoms, so there are tests that are done to confirm whether or not we have SLE, and subsequently management is started. So given that this is a condition whereby the body's immunity is working against its own self, the kind of medication and care that is given is normally to regulate the immune system such that these flare-ups are way less, or rather they die down Secondly, because photosensitivity is one of the symptoms of this disease, patients as well are encouraged to do photoprotection, and by that I mean covering the areas of the skin as much as they can. And for the exposed areas, the patient is encouraged to use sunscreen. So in the case of pregnancy, often in a situation we have SLE, there is a lot of things that may contribute to complications towards this pregnancy in a patient who has SLE. Sometimes can be kidney issues or other places that the disease has affected. One of the major complications that comes about as a result of a situation whereby we have a patient who has lupus and at the same time they're pregnant is that the viscosity of the blood increases. And by the viscosity, I mean that the blood becomes a little bit more heavy, and as a result, it makes a lot more clots. Then that means the flow of blood is hindered in one way or another, and this might lead to miscarriages as well. SLE is a multisystemic disease that is managed in a multisectoral approach. That means everyone comes on board to ensure the comfort of the patient. And now, you are in the know.